Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is 5 things to ask yourself before undergoing elective back surgery. How many surgeries are there performed on the lower back in the U.S.? There's over 600,000 performed every year, and half overall will not obtain the desired outcome. In fact, 10% will actually end up worse than they did before the surgery. So the first consideration when you're posed with whether or not to have low back surgery is whether or not to seek a second opinion. Now, a second set of eyes may be indicated since this is a big decision. Now, most back surgeries are elective. Now, if you're looking at something where you have a foot drop for, a herniated disc with sciatica, that's not really what I'm talking about. But if you're simply having a lot of pain from degenerative disc disease, adult scoliosis, or degenerative spondylolisthesis, these are the types of things that are elective, right? So you may get a second opinion and the new doctor may say, I recommend the exact same procedure that the first one did. So then you have that level of comfort. Or they may say, you know what, I do think you need surgery, but I would recommend doing it a different way. They may be better with minimally invasive. The original doctor may be a little more old school and do more open procedure, so you may have a difference of opinion there. Or the second opinion doctor may say, you know what, I just do not think you need surgery at this point in time, or ever. So there you go. The second consideration is, can you look at yourself in the mirror and say, I've actually tried all the conservative options before surgery? And this may include, over-the-counter medications, physical therapy, chiropractic treatment, spinal decompression therapy, acupuncture, pain medications, or maybe neurogenic medications like Neurontin, or interventional treatments. On the right here you can see a radiofrequency ablation, which is where the pain doctor will outpatient procedure burn these little nerve endings here, free up nerve pain from these joints, and that may give you back pain relief for 12 to 24 months. Amazing time frame there. So have you really tried these types of things before electing to undergo surgery? The third consideration is to really sit down and do a risk-benefit assessment prior to the surgery. No spine surgery is risk-free. Bigger procedures like adult scoliosis have complication rates over 50%. And that's not necessarily big complications, but those could always happen. So that's something that you need to think about. The standard complications for surgery would be infection, bleeding, nerve injury, risk of anesthesia, risk of failure to fuse, scar tissue forming later, all these types of things that can go into a spine surgery. And is that worth the benefit? The benefit may be huge, but you have to take it all into consideration. The fourth consideration is to do a reality check on what you're trying to achieve here. Most back surgeries do not achieve 100% pain relief. In fact, half end up with an outcome that's just not desired. 10% might get worse. And ask yourself, if half of my pain goes away, is that good enough? Okay? Or if 30% goes away, is that going to be good enough? Am I going to look back and say, I'm still glad that I underwent the procedure? Here's a quick example. In 2003, when the FDA clinical trial was going on for this procedure, the artificial disc replacement versus spinal fusion, they looked at the outcomes. They didn't have to show superiority to a spinal fusion, which is considered the gold standard for degenerative disc disease. They just needed to show similarity. So what did they show? Well, what ended up showing was that they had a decent outcome, but 50% of patients in both groups still required narcotic medications a year after surgery. So that's the gold standard. Half of patients still need narcotics. Well, that's, where we are. So you have to take that into consideration and be really realistic with what you're looking at. And the fifth consideration is the timing of surgery. For elective surgeries, you can pick the best time. If it's a school break, if it's the summertime, if you're a teacher, or if you have a sabbatical coming up from work, these types of things need to be taken into consideration because here's some rehab considerations. For a simple lumbar laminectomy, you're looking at probably 6 to 8 weeks, maybe 10 weeks, to get back to full activity. Spinal fusion, you're looking at around 3 months on average. And then for adult scoliosis, a big procedure, you're looking at 6 to 9 months, sometimes upwards of a year before you get back to doing the types of activities that you really want to. All right, so those are really the 5 considerations you should look at before undergoing surgery. The bottom line is that the objective is to feel comfortable with the decision that you make, even if surgery does not produce the desired outcome. And it's reasonable to work through these 5 considerations so that at the end of the day, you can look at yourself in the mirror and say, you know what, I really tried everything else. This pain was just totally killing me, so to speak, and this was the right decision for me. In Nevada, the top non-operative pain management through the Nevada Pain Network is at nevadapainnetwork.com. The phone number to call for one-number scheduling is 702-323-0553. You have multiple pain clinics in Las Vegas, Summerlin, Henderson that accept over 50 insurances and over 25 treatment options. Success rates are very impressive at over 90% with the board-certified, award-winning pain management doctors, chiropractors, physical therapy, acupuncture, the whole gamut of helping get you better without the need for surgery. Thank you very much. I'm Dr. David Greene, CEO of the Nevada Pain Network. Your pain stops here.